around 2:02 here, just to make sure everybody gets some time to creep in. Thank you, everyone who's on here on time and ready to learn a bit about the system, not the symptom.
Well, since we have a behavioral health crew, we could kind of go with the diagnosis, right? Not the
Oh,
system, not the symptoms.
that's exactly the case. There's many different variations we could have sort of come up with the title here. I think we arrived at the right one though. So, all right. All right, we have a lot to cover, everybody, so I don't want to delay too much. Just want to make sure everybody gets some time to pop in. I still see a few folks coming in. I see a lot of familiar names in the attendee list, so welcome everybody. All right. All right, all right. So, Keira, I'm going to go ahead and get us started because we have a good amount of attendees so far. Want to respect everyone's time, want to respect your time, and make sure we have a lot to cover because it's going to be a very, very informative webinar today, team, and I'm particularly excited about it. We're going to reintroduce ourselves in subsequent slides, but thanks everybody. Adi here. A lot of you may know me already from working within our ecosystem. It's a pleasure. I see a lot of familiar names in the attendee list. Thank you for joining us. It is a Thursday with Friday around the corner. There's a lot of things you could be doing with your time. So we really appreciate you taking the time to spend with us and learn a little bit about compliance and a lot of the things we're doing around that. So the title of our webinar today is The System, Not the Symptom, Reframing Behavioral Health Compliance as an Operational Design Challenge. Let's move on here, Keira, if you can. And let's back here. Perfect. So this is a quick overview of our agenda today here, team. We're in our introduction phase here. We're going to move into the second step, which is compliance. Problems are symptoms of design gaps. It's going to be very informative. Where things break, coming in at number 3 or 4, what high performing organizations do differently. We're going to move into practical takeaways. We're going to move into our closing, and then we're going to move into our questions and answers and our final thoughts. Quick disclaimer here around the Q&As. We welcome questions. We want all of your questions. What we're going to do is keep a running list of questions that you can go ahead and throw in the chat. And at that time, we're going to make sure to take all of those questions as much as we can, of course. And then, of course, any subsequent questions we can't get to, we will do that in our follow-up conversations, which we hope everyone is looking forward to. Move forward, Keira, please. All right, now some quick introductions. Hopefully a lot of you already know me. My name is Adi. I lead revenue operations here at Opus. Been with Opus for 9 years. Where does the time go? Every time I say that out loud, it's just mind-blowing. But, before that, as a lot of you know, we were treatment operators. We were actually providers and provided these services. We've dealt with a lot of these problems. Certainly, I wish we knew Keira about 10 years ago. Our life would be a lot easier when we were actually running clinics. But being on the software space, we have compliance questions all the time from a lot of you friendly faces we see as attendees and a lot of our newer customers coming on. So it's an absolute pleasure to be participating in this webinar with Keira. And, while I am, very happy with a lot of the partners we work with, Keira, I think, takes a special place in my heart. Just number one, the type of expertise she brings to the table, the customers she's worked with, the different states she's operated in, her attention to detail, her system-oriented mindset. I feel I always learn something when I'm speaking with Keira, and that to me is really the most important thing when I'm interacting with a colleague, a customer, or any of our team members. And Keira is the president and principal consultant at KGE Consulting. We're very proud to have Keira as part of our partnership program. And Keira, with that, I'm going to actually toss it over to you for your intro, but I will also say one more thing, which is for me, team, it's a pleasure to sort of be in the passenger seat along with the rest of our attendees for this webinar. I really want to let Keira take us through the slides. and really have the time to sort of teach us about all of the different learning she has and all the different problems we can avoid in compliance and the like. So with that being said, Keira, please go ahead with your introduction and we'll go from there.
Hey, thank you so much, Adi. Really, I'm honored to be here, to have the opportunity to share quite a few things I'm really passionate about when it comes to supporting provider teams, supporting really good quality patient care, and really protecting organizations as they're continuing to grow and expand access to services. Big thank you to Opus for hosting this presentation and the strategy session. And without further ado, I think we'll go ahead and jump in. I will say I usually love to dive into examples, but in the interest of time and also in hopes that we will have adequate time to do some live Q&A, I will try to avoid diving too much into the examples, but you will receive a slide deck along with the post-session communications that'll include a case study that will really demonstrate how we can implement these strategies that we'll be discussing today from real life scenarios. So without further ado, can't wait to jump in. So we have 3 learning objectives today, priorities. First of all, we'll go over how to identify systemic versus isolated friction points. I'm sure there are a lot of behavioral health leaders on the call today, and I'm sure we are very familiar with hearing all kinds of kind of isolated sounding problems, and it can feel really overwhelming. So we'll kind of go over some strategies for how to have a more systemic lens and therefore be able to implement systemic solutions. Learning objective number 2 is to develop systemic solutions, as I just went over. So we'll have some practical takeaways for how to actually integrate compliance in our day-to-day operations. But also how to have a really strategic approach to build scalable infrastructure that'll remove limitations to growth and really support your business and support your providers in growing and expanding access to care. Third learning objective is going to be how to optimize performance through operational design. So we'll be talking about just some key strategies for ensuring that we are supporting our rockstar providers, our rockstar employees that we hire because we know they're capable of doing a really good job. How do we as behavioral health leaders ensure that we're doing everything we can to support our staff in being rock stars and support them in providing high quality care through our operational design, make sure that we are being rock stars as operational leaders as well. All right, so most compliance problems are symptomatic of operational design gaps. What I mean by that is oftentimes we see individual symptoms start to kind of bubble up. We start to hear maybe some whispering, some kind of unsettled feeling in the organization, and then we start to see things become more immediate to attend to. So you may see things such as staff confusion. Maybe some of our staff are confused as to which workflow applies to which situation. If something small is different about a situation, does that wipe out the entire workflow? Do we have to do something different? You may see people who are confused about, are we doing things the way that we've always done them? Or are we implementing this new idea that someone mentioned at the team meeting last week? So you may see issues come up with staff confusion. And if staff don't know what policies or what workflows to follow, all of a sudden you've got a big compliance problem because you can design anything you want. We have to make sure that staff have access to the appropriate information. You may see issues happen with documentation inconsistency. And that can lead to major issues with, first of all, obtaining authorizations sometimes, but also getting payment for claims in the first place. You may see claims denial start to increase. You also may see claims paid initially. But what happens when the payer requests medical records? So they do an audit and they review your records and they realize there's a lot of inconsistency. Some of your documentation doesn't meet their standards and therefore they're asking for repayment. So these are issues that we see kind of on the surface. Once they have reached a point where they're directly impacting either our bottom line financially, they may be impacting our provider retention and provider burnout. They may be impacting our quality of care. All of these kind of feelings and present symptoms will oftentimes lead to audit anxiety. So We may, know when a payer audit is coming, or may fear that it may be coming. We may know when we're up for another accreditation survey, or maybe the state is going to pop in unannounced and look through all your stuff. So there are things that we're usually aware of in terms of compliance problems. And there's also this other category where we know that we don't know what they're going to find sometimes. So before it gets to this point, and I think the big misconception here is that these are all individual isolated problems. When we as behavioral health leaders view these things as individual problems, it can be really overwhelming. We may have a list of 20 things that we know we need to address eventually, but maybe we're expanding our services. Maybe we're trying to secure a contract right now. We have bigger issues to tend to. And it becomes something that is going to be difficult to address. It can be overwhelming. So one strategy I like to discuss is how do we start to detect these issues before they get to the surface, before they hit their boiling point, before they become issues that are way more urgent than securing this contract or whatever we thought the priority was last week. There are a few different sources of data. And these different sources, these are areas we can pay attention to that will help us detect when things start to simmer before they get to a boiling point. And I hope this analogy is landing, but works for me. So we can look at operational bottlenecks. So if we're starting to see inconsistency with clinical documentation, we may see issues with cross-functional communication within our teams. So maybe your primary therapist is sending one message to the patient, and the family therapist is saying something that's slightly different in terms of treatment recommendations to the family or the support system. Maybe we are hitting some delays, for example, for discharge planning. We're seeing departments who aren't quite operating as streamlined, as efficiently as they could be, or as collaboratively. You may see this happen with marketing teams, for example. So you're going to have a whole team, hopefully, if you're lucky. You may be a small organization and maybe one person is wearing 15 different hats right now. But provider relations are really important, right? We want to keep in touch with our referring community partners. We want to know when we're admitting a patient who has been referred directly from somebody we've developed a relationship with. So if you start to see breakdowns in the provider relations team knowing or being notified when a patient admits so they can reach out to that provider, or maybe some breakdown in discharge planning, or what I like to call diffuse responsibility, perhaps there's an issue in the system where maybe the whole team decides that this next step, this next intervention is definitely recommended for the patient, or maybe we need to find these resources to start the discharge plan, but nobody's assigned that task. I like to, again, refer to that as diffuse responsibility. That can break down and that can directly impact patient care. You may start to see some whisperings with payer relations. So maybe you're having trouble getting authorizations. Maybe you are partnering really closely with maybe new health plans you're contracted with, and they're starting to say, we're not super happy with the clinical information that's coming our way. Now, you as a behavioral health leader, and when you're speaking with providers, you know that you're offering really high quality, top-notch care. You know your patients are happy. You know you've hired the best team to treat them. But for some reason, somehow, that isn't being effectively communicated to your payer partners. And FYI, I love talking about how to effectively translate between clinical language and payer language, medical necessity. They're very different, and there are a number of strategies we can use to really help advocate for our patients. So you may start to see issues come up, friction come up with payer relations. You also may start to get data on patient and provider satisfaction. Quick note, if you are not currently doing patient satisfaction surveys, if you're not currently doing fairly frequent, maybe once a quarter, maybe twice a year or so, staff engagement surveys, start doing those now. They're super low cost. They can be very simple, super low bar. They can be user friendly, but it's a really good way to start detect when you're starting to get consistent feedback. So maybe on the patient satisfaction surveys, you might start to see that everyone's really thrilled with the services you're providing. But you're starting to see a lot of comments about confusion around the discharge process. Like, hey, I wasn't ready. My team and I hadn't really talked a lot about discharge. I was told insurance denied me. Well, when that gets back to the insurance company, you're going to have payer relations problems after that. So you may start to detect some patterns, both in kind of provider burnout. You might start to be able to see some issues with communication. But anyway, these are really good sources of data. And when we pay attention to operational bottlenecks, issues with payers, as well as feedback we're getting directly from providers and or patients, that'll allow us to have more of a bird's eye view of what's going on in our system, what's going on in our organization. And when we start to hear those kind of singular examples that feel overwhelming as they accumulate, we can also start to recognize patterns and recognize what might be breaking down in the system and where. Hopefully this is all making sense. Okay, so once we've become completely overwhelmed with individual issues that are happening, and we're kind of thinking, gosh, how do we attend to all these things, all these compliance problems? And then we take a step back and we look at, okay, are we starting to look at patterns? Are we starting to see similarities? Next, we look at operationally, how are these all connected? That helps us identify that heat source that turns into simmering, that turns into the boiling point. That helps us really streamline our resources in trying to identify and resolve some of these problems from a systemic lens. Okay. Before we hop into what high-performing organizations do differently, let's talk about what we see very commonly across the industry. In the beginning here, sorry, in the middle of this graphic, you'll see the ideal system, right? We set up workflows, we set up policies, hopefully, and they're supposed to be pretty simple, right? We start off with pretty simple ideas, but we start to notice problems. And as behavioral health leaders, especially, or generally just human beings in the helping profession, we want to resolve those problems. If you hear that something is creating stress for a patient or a provider, any staff member at all, we want to fix the problem. And this is good. These are all the cycle that you see on the outside here, that was paved with good intentions. When we start to implement what I call bolt-on solutions, where we hear a problem, we fix it quickly, maybe we create an interim solution and we say, hey, we're going to circle back to that in 6 months. Sometimes that just doesn't happen, and we end up with sort of half-baked workflows, things that are supposed to work for the interim, but they're not really designed for long-term success or sustainability or scalability. Or we end up with something that just doesn't make sense given our current technological capabilities. We can do much better now than we could 3 months ago. We grew really fast. We have access to other technology now. So what we start to see it look like on the system is what should have been kind of streamlined, what was intended to be streamlined, starts to become really convoluted as we bolt on solutions one at a time without that larger systemic view. Over time, as these accumulate, we start to see operational friction. So there are redundant workflows. Any finance people on the call, this means that you're paying 3 people to do the same job. Just kind of a heads up. So you start to see operational friction. And that just ends up with a really kind of clogged system, an engine that isn't working very well, right? When we start to see providers, other staff members start to duplicate work, and they have maybe 3 workflows that are resulting in unnecessary administrative burden, that will kind of flow into administrative backlog, because all of a sudden those staff members are beginning to need to prioritize what responsibilities they want to get done today versus what they think might be lower priority. Obviously, we want every staff member to achieve all of their responsibilities, and we want to be able to provide support and resources to do that. What this looks like and where the high risk areas are, say you have a provider who they know that they need to see their patients, they know that they need to deliver high quality care, they know that they need to document it. You might start to see other things slide, such as how often they're supposed to update treatment plans, or perhaps how often they're supposed to update safety plans, or perhaps how often they're checking in and coordinating care with the outpatient providers. Those things may not seem urgent right away, but if they're pushed, if they end up in an administrative backlog, that will create some pretty significant issues down the road, especially if any adverse events occur and your records are looked into and we see, hey, that safety plan wasn't updated. Why not? So let's make sure we're trying to prevent those things from happening. It can also lead to provider burnout. So we have, we hire rock stars. They're passionate about their care. They're passionate about, implementing everything they learned in school. They are just excited about their jobs. But if they're working in a system that has a lot of lag, maybe it's kind of a clogged system, they are overwhelmed with administrative backlog, they start to burn out. They start to lose their zest. Maybe they are still giving everything they have to the patients. Maybe they stop engaging in self-care. That'll impact your provider retention. That also impacts patient care usually after a while. Patients can feel it when the providers are burnt out. So traditional bolt-on solutions, they come from good places. We're all trying to fix problems. We're all trying to alleviate friction. But oftentimes what we see is probably what you've seen across different organizations you've worked with or for. We start to see this kind of part on the right side, which is the overall systemic impact of it. So, not to be a Debbie Downer here, we've gone over what not to do, right? And what we commonly do sometimes. So what do high-performing organizations do differently? How can these rockstar startup organizations start and grow and have amazing outcomes clinically, have amazing partnerships with their health plans, have amazing reputations as employers and in the community for referrals? They stop and they assess what are the systemic influences that are resulting in all these symptoms that we're seeing. And before they implement any of those solutions, so any of those bolt-on solutions, or when they're evaluating how do we fix this problem, there are any number of ways to fix any given problem. We ask 3 key questions. And you'll receive a copy of this slide deck, but I also want to encourage everybody on the call today, burn these in your memory if you can. These are really, really important for avoiding that kind of systemic friction and provider burnout. Even if we have a solution that sounds really good, always ask 3 key questions. The first one is, what problem are we trying to solve? This may sound simple, however, if you are hearing about problems from your admissions team, your marketing team, your finance team, your clinical team, they may be all describing something that is related, maybe even describing the same problem, but their lens is going to be very, very different. And the way that they describe and they identify the problem is going to be very, very different depending on what their priorities are, what their incentives are, and what their job responsibilities are. So if we're trying to look at potential solutions, we have to make sure that we're aligned and we're actually describing and identifying the same problem. So it's important to assign scope to this problem and for anybody who's involved in the solution to also be aligned in terms of what are we trying to solve here. So what is the problem we're trying to solve, first of all? Second is, does the proposed solution actually solve the problem? Again, this might feel obvious. However, sometimes solutions, when they're proposed, they sound really, really good. And we all want to jump on board and say, yep, we have a solution. Let's do it. Let's get this rolling. And that's how we end up with those kind of interim, sort of works, sort of doesn't, bolt-on solutions. So we have to ask ourselves, okay, great. We've come up with this solution. Let's look at the problem again, how we've identified it. Let's go through the workflow. Does this actually solve our problem? If it solves 80% of the problem, you may determine that it's worth the lift. Hey, this gets rid of a lot of it. That's great. You may determine that that's not worth the lift at all if we're left with 20% of the problem still left. So what is the problem we're trying to solve? Does the solution that I'm considering right now actually solve the problem? And number 3, I think this is most important. Does it create any other problems elsewhere in the system? I'm sure that, but I hope everybody, actually, I want to encourage everybody on the call to think about times when this has occurred. Say you are experiencing an issue with admissions workflows. How are we communicating admissions to then the clinical team? How does the clinical team communicate with the team? Or, maybe the clinical team is spending way too much time trying to get records, and we decide, hey, that's not a great use of their time. Well, great. One solution could be we'll have the clinical team stop requesting records and we'll kick it over to this team who's non-clinical, more administrative. That'll resolve this issue for this clinical team. It creates a problem elsewhere in the system. And so the solution, although we might think that it might be a good one, if it creates a problem, it kind of kicks the can to another department, then that department may start to be overwhelmed and burning out, and then you've just got another problem going. So three key questions anytime you're looking at, how do I solve this problem? What is the problem? Does the thing I'm considering actually solve the problem? And does it create any other problems elsewhere in the system? This is also why it's really important to involve as many stakeholders as you can. You're obviously not going to establish a committee every time you have an issue that comes up. But the more input you can get and the more stakeholders you can involve in either just getting data, getting information about what's going on here, or exploring different potential solutions, you're going to be able to detect really quickly if this proposed solution over here is going to impact that team over there. So try to kind of keep a bird's eye view on your entire organization, how things function together, and what issues they're running into. So you'll receive a copy of the slide, but mental note right here.
And Kira, real quick, I love this slide because as we're talking about the context of behavioral health here, this applies amongst all of our lives in general, whether, and as we've been preparing for this webinar, I've been just thinking about this. It's been kind of, as you said, burned in my mind. And I find myself applying this to everyday situations. The dog water food bowl and what the problem is with that and amongst all the other miscellaneous parts of life. So just to double click there again, team, if your attention is waning, very, very important slide. And as Kira mentioned, we will have this over to you as well as some other artifacts when we're done. So thank you, Kira.
Yeah, thanks, Adi. All right, just in case attention is waning at all, we've got a more interactive version here. So pop quiz. And this is kind of an exercise of, can we identify anchor points? Can we identify things that all these things might have in common? So what do these four core operational areas all have in common? Clinical care, billing and finance, discharge planning, and payer relationships. I'll give you a moment to think about that. Adi, I don't know if they can drop anything in the chat, but I'd
They
love to hear.
absolutely can.
Amazing.
And we do have a question. Thank you, Pierre, for that question. We're going to be getting to questions later on here. But as for the pop quiz, please, please, please feel free to pop in to any answers to this question that we have here. What do they have in common? What do these sections have in common? Give everyone a moment.
And as kind of a hint to, what do all of these departments rely on to be able to have the outcomes they're looking for, or to get information to perform the responsibilities? Anything in the chat yet, Adi?
Not yet. Not yet.
Okay. Well, no worries. We'll jump right into it.
Let's go ahead.
Okay. Medical necessity. And this, you'll actually see this demonstrated in the case study that you receive. The case study that you'll receive in the email kind of goes over issues from all of these different departments. And what we did is we realized, hey, there's a core anchor point. There's a common thread here, and that could be the source of a more systemic solution. So in terms of the clinical department, clinicians must capture medical necessity accurately and have appropriate clinical documentation. I could dive into that. I could probably do a whole webinar on that, but we'll kind of settle there for right now. For billing and finance, their billing codes need to match The documentation of services rendered, timeframes, medical necessity has to be there. So they rely on medical necessity. For discharge planning, of course, we're looking at there's a huge spectrum between when the patient admits to care, treatment, they clearly meet medical necessity criteria. They obviously really need care right now. Insurance authorizes it. And there's this whole course of treatment that occurs until the patient is ready for a successful transition to a lower level of care. Along that continuum, we're looking at getting to know the patient, getting to know their triggers, getting to know what coping skills they have and or will acquire in treatment. We're getting to know their support systems. We are learning what they're going to need to be successful upon step down. Throughout that continuum, ideally, we're communicating with the discharge planner, should you be so fortunate as to have one. But they're kind of learning too, how are we going to make sure this patient is set up for success? In terms of payer relations, I think I can skip right over that one in terms of why medical necessity is important. They establish their criteria in the first place, and we need to make sure that we're effectively translating clinical care to payer relations and medical necessity criteria. So that's just an example of how we can look at a systemic approach and see, can we fix one thing? Can we make sure that there's quality information going into the system so all of these departments can pull quality information and can do their jobs very effectively? All right, so stakeholder alignment. This is the second slide that I want to bring your attention to. This is the slide where we're going to talk about how to, not only when we learn how to approach things from a systemic lens and solve problems from a systemic lens, but here we're talking about strategies to ensure that we're integrating compliant practices into our daily workflows, and we're ensuring that there's good quality information going into whatever systems we're using. A big one is going to be your EMR. So we can really streamline communications and cross-functional efficiency. So first of all, stakeholder alignment. I'm going to touch on that quickly because, as I mentioned earlier, it's really important. It's both important for input, so you get a lot of information from having cross-functional representation of stakeholders. If you hear from your finance team, your marketing team, your clinical team, you hear about what's working well, what isn't working well, that will give you a bird's eye view of how the whole system is functioning, what the system health is. But then also, once we're trying to implement different initiatives, maybe compliance initiatives, maybe clinical quality initiatives, whatever we're trying to roll out to our teams, especially if they're cross-functional initiatives, stakeholder alignment is also really important there. As an example, I mentioned how each person, depending on the department, their role, their main incentives, maybe what they're passionate about, you're going to hear a different description of related problems. When you are sending your messages back out to staff, you're messaging your different department leads or maybe frontline staff, or you're trying to support them through managing change. That messaging is also really important. You want to make sure that you're sending a message that's going to land with the finance team, that's going to help them understand how this new workflow impacts the bottom line, or maybe makes their job easier, or maybe it's going to be more cost effective. You may describe the same workflow to the clinical team in terms of how it's going to impact patient care, because that's what they care about. As an example, if we're discussing clinical documentation, how many times have you talked to your provider teams and you've said, hey, we have to include X, Y, and Z in the progress note? What's the rationale that we give? If we say because JCO says so, or because it's part of the system that we use, or because we don't want to get in trouble, that might land for a second, but usually it's not super sustainable because it doesn't land where they care. So as an alternative solution, if we're discussing clinical documentation with providers and we say, hey, we really need you to include X, Y, Z in your note because it'll improve the patient's likelihood of receiving authorization for care. And so we'll get more time with you to actually engage in this treatment. It will maybe help them get approved for their short-term disability claim so they can receive support while they're also receiving treatment if you include XYZ. Also, and this is an example I like to use a lot. Let's go ahead and fast forward 5 years from now. Say there's something bad that happens, say that there's a patient allegation or a family member allegation. But I always like to encourage providers to, I call it CYA, but consider your audience when you're writing a note. Picture yourself on the stand in 5 years, and somebody's saying that you did or you didn't do something that you either shouldn't have or should have done. Can you reliably go back to your note and confidently defend your clinical decisions, what did or didn't happen throughout the course of treatment, and can you protect your license? Well, if you give providers that type of delivery in your messaging, all of a sudden they care much more than just saying do it because I said so. So just a quick note, when we're talking about sustainable systems, make sure your messaging is going to land with your audience. All right, next portion here. I am a firm believer that 98% of your staff want to succeed. They want to show up, they want to care about what they're doing, they want to know that their contributions matter, that they're adding value, what they're spending 40 hours or more per week on means something, right? And so our job then as behavioral health leaders is to ensure that we're providing everything that we can to support our staff in continuing to be rock stars and continuing to care genuinely about their performance. So staff generally need three key things, three key ingredients to make this happen. The first one is going to be adequate training. The second is adequate support and resources, and you acquire that through system design. And the third is accountability. So we'll stop and touch on each of these points here. So adequate training, when our staff show up to their job, and this is, by the way, how you start to build a culture of compliance, as opposed to just kind of saying you have to follow the rules. This is how we really ingrain it into the system and support our staff. So for training, do your staff understand what their job responsibilities are and what success looks like in their role? Do they understand what they're going to be measured against, their KPIs? Do they understand how to achieve them? That's adequate training. On a side note, in terms of protecting your organization, you also want to make sure that the training is documented. It's one thing to do it. It's another thing to be able to show maybe 5 years down the road if you are, being cross-examined by somebody who wants to make it look like the organization is at fault. You want to be able to show that you provide consistent, comprehensive training to all your staff so they know what to do, how to do it, when to do it, but they know how to do the right thing. So if somebody doesn't, you're still protecting your organization and showing that you've done your due diligence. Just a quick side note there. So once you've trained your staff and they understand what their job responsibilities are, next you want to look at, are we as an organization providing support and resources for them to be able to achieve those responsibilities? Do they know where to find information when they have questions? Or are they maybe relying on one person responding to an email? Do we have a system design that allows for cross-functional communication? Do we have workflows designed so there's really clear assignment and ownership of tasks where once the admission team finishes their part, they can kick it off straight to the clinical team. The clinical team gets a flag. They know that they have work to do right now. But is there really good streamlined communication, as well as is our system designed to make it just plug and play, drop down, push the right buttons, spoon fed, here's how to do your job really well? What I mean by that is, do they have access to information or dashboards really to show them where they're standing? Do they have clinical documentation that's overdue? Do they have a safety plan that's overdue? Do they have claims that need to be submitted, or maybe some appeals that are pending right now that finance can follow up on? But how are we providing support and constant feedback to our staff to ensure that their jobs are really easy because they want to be successful? And the third part is accountability. This is a really big piece. I want you to kind of stop and pay attention. What happens when I say accountability? Do you feel a sinking feeling in your heart? Are you noticing any like little butterflies or maybe some feelings in your shoulders or anything when we say that word? Are you thinking about maybe a past experience with either giving or receiving feedback? I think oftentimes the word accountability is associated with kind of negativity or punishment or criticism. So sometimes as leaders, we can be, I've seen some hesitancy in providing accountability frequently, clearly, and genuinely to our staff. But if we look at our staff and the fact that they all want to be good at their jobs, ideally, you're going to have three different categories. You're going to have people who are knocking it out of the park and they're just excelling and exceeding their responsibilities. Um, you're going to have people who are just barely meeting their responsibilities, and then you're going to have people who are struggling. Let's go over why accountability is important for all three of those categories. First, we're going to talk about positive reinforcement, which I like to think is a kind of a form of accountability too, of hey, I want to recognize this person. This person is clearly knocking it out of the park. They're doing great. Let's recognize this person either publicly or individually, depending on what might feel best for them. But they're working really hard and they're going to want to know that you see them and you value their contributions. That type of positive reinforcement goes a lot further in certain terms of setting an example. And again, we can talk about like compliance too. If everyone else in the organization sees that this person is doing an amazing job and they made the right report at the right time and they participated in an investigation, you're probably not going to actually publicize that part, but as an example. It sets a precedent. It shows what we want to see as an organization. Now, the people who are kind of barely meeting the requirements, they're going to work really, really hard for that to happen. And they want to be recognized. They want you to see that they're working hard, and let's talk about growth and challenges and how to support you. The people who are not quite hitting the mark, it's really important to have a system that is set up to give them feedback before their manager even does. We want it to be really clear where people stand, especially from an HR perspective too, so they can self-correct or ask for help before we even detect that there's an issue. I see we're kind of running short on time here, so I'll flip forward. But I do want to just kind of review this slide in itself. This is your key to sustainable, scalable infrastructure that will systemically support team performance and compliance.
And as you're moving slides here, Kira, what was that term used? Was it a culture of compliance? Was that the phrasing? Just wanted to
Yeah.
bring that back up as it serves sort of as a mental model for that very important context you were given. Thank you.
Yeah, thank you so much, Adi. I love talking about culture of compliance because compliance can be scary. It's kind of that is, put right in that same category as accountability. Yeah, I've had experiences where I've walked down the hall and it's almost like a confessional where people are coming out and saying, I'm behind on my notes. And,
Yeah.
the face of compliance, when we talk about encouraging our staff to make the right report, make the right decision. If you make a mistake, let's talk through it together. Let's figure out
Yeah.
what is the next step.
I
That
felt that
culture,
feeling as well when you were talking about accountability, and it's, but when you embrace it, when you accept it, and when you create that culture, it's you can avoid that sinking feeling because it's something you live every day, and once you're caught up, you're feeling a lot better. So thank you.
yeah, thank you. Side note, people who have been accredited by the Joint Commission for maybe the last 10 years or so, you've probably seen that shift. They used to be a bit more kind of punitive in the way that they conducted their surveys and gave feedback, and the kind of gotchas, the dings. They recognized that that was creating some issues and that kind of culture was, I'm going to get caught. So they've actually made that shift to have a more supportive, collaborative partnership. So you see it across the industry. I think it's going in the right direction. But yeah, we talk about compliance. Let's talk about collaboration, villages, teamwork. It's everybody's responsibility, and let's support our staff. I'm happy to go over this kind of almost last slide, and then Adi, I'll give it back to you. But just kind of in quick review. Check in for yourself, for your organization. How are you doing on training? How are you doing on setting up systems that actually reinforce and support your processes? Or are your current systems fighting them? Again, we want to spoon feed success to our staff and make it really easy for them to make the right decision. And we do that through systemic design and always asking that third question, are we creating any problems elsewhere? And then, yeah, how readily available are reports related to compliance? So, do we as behavioral health leaders have really good kind of dashboards, reports, or we have a pulse on what's happening, especially those patient provider surveys? Um, yeah, do we know right away how we're doing, and can we use that data, junk in, junk out, quality in, quality out? So whatever system you're using, especially your EMR, ensure that you're guiding everyone to input good quality data. That way your various functions, your various departments can pull quality data and do a phenomenal job. Thank you so much for your time today. I've really enjoyed the discussion. I hope that you have too. And Adi, I'll kick it back to you. Thank you so much.
Thank you so much, Kira, for that wonderful content you took us through. And although the sort of theme for our talk today was around compliance specifically, and at least for me, sometimes I can box compliance into a box, so to speak, of what's written on the note, what time frame did we get that completion, and all of these rigidities. I think hopefully the audience today captured that a lot of what we covered today apply to other areas, whether they be admissions and clinical documentation, billing, and so on and so forth. So thank you so much for taking us through that and explaining it so clearly, at least for somebody like me. So as we're starting to wind down here, team, we are going to be taking some questions. And we hope you have questions, of course. But we want to make sure you know what's coming to you once we wind down. And one of our wonderful marketing team members, Sai, who's on the call, is going to be coordinating this for us, which is you're going to be receiving some compliance assessments from us. You're going to be, first of all, receiving this presentation that we've gone through in case you want to review it. From the Opus team, you are going to be getting a support compliant workflow document as well. And I believe Kara and her team are going to be sending over the compliance program assessment as well. Um, that's going to be curated. Once you get that, take a moment to review it, walk through the assessments with your team, and use the tips from the compliance checklist to immediately boost any compliance gaps that you have. And hopefully you could remember that four-step process or three-step process of do we have the right problem? What are the secondary, tertiary problems, and so on and so forth that we covered. So Kira, if you could move to the next slide here. And if you're not sure where to start, we'll make it very, very easy. Of course, you can come contact us and our team. We'll set you up and book a consultation with Kira. We'll make sure you have her information and how to get in contact with her and how to book those consultations. We're going to make it as easy as possible for everybody. And yeah, if anything with the actual technology portion, if you have any questions, some setup things, I noticed Pierre in our audience has a question around an existing issue that we're working through. We're going to be able to get some help there. We can absolutely do that. And in the bottom right-hand corner, take advantage of the limited time offer. If anybody wants that $100 gift card, be one of the first 3 attendees to book with us and take advantage of that gift card. So we can move, I believe, to the next slide, Professor Kira, which are probably my favorite part of the whole thing, as well as the content as well, is making sure we get to answer some questions. Okay, so let me go ahead and take a look at any of the open questions here. Please, team, if you have any questions that you think are centered around compliance, any sort of issues you're dealing with today, you want our opinion on and our thoughts on, we're happy to do that. We're going to be doing that for about the next 2 to 3 to 4 to 5 minutes, depending on how much time and how many questions we get. So please feel free to put that in the chat and we will go ahead and wait. I think a few folks were having some trouble finding this portion. So it's not the chat that you want to go to in the actual Zoom window area. There's a place that says Q&A. You can click on that and that should open up a place for you to go ahead and drop in any questions that you have. Yeah, Kira, I'm going to have to steal some of those phrases that you use from you as we start to have our conversations, and particularly that culture of compliance is a mental model for me, right? To start operating at that baseline level. I think would be very helpful.
Yeah, and that the stakeholder alignment piece too. I remember talking to just one of my colleagues at one point, and I was kind of describing um, everyone who's around the table. They may have different incentives, different priorities. It can seem like they're in conflict, but once we find a common language, once we find kind of a common goal, all of a sudden we can really start to align people and get stakeholder buy-in. Um, and I'm also happy to kind of do a quick kind of overview of the case study that we're receiving that really highlights how to implement some of these strategies because we're a bit more theoretical in the presentation today. So if you see
Let's do
any questions,
let's do that, Kira. I think that might give some folks some time to maybe type out some questions or come up with any questions. So yes, please, if you're ready to do that.
absolutely. And if you see anything come up, just let
I
me know,
will.
interrupt. So an example, and what's highlighted in the case study you received for how to implement systemic solutions. So at one point, I was asked to take a look at a major friction point, and there was a startup, a very successful startup, who was starting to have issues with payer relations. The payers were saying, we're not really satisfied with the clinical information that we're receiving. We're not sure about the services you're providing. They don't quite seem to be what was pitched, what was sold. But anyway, they started having some major issues that were threatening their contracts, threatening their expansion, and threatening their livelihood because of it. So I was asked to take a look at just the relationship between the utilization management team and the payers. I did look at that, and there was certainly a lot of improvements and some training that we did to ensure that the UM team was getting good quality information to the payers. But as I was looking at that, I also started to pull in the clinical people, and I was pulling in provider team, and the provider team was saying, hey, we don't really know when our patient's going to discharge. We're hearing that insurance is cutting out, or also we don't feel like we have a say in using our clinical discretion for determining whether our patients are going to stay in continued care or discharge. Similarly, we looked into the patient satisfaction surveys, and all the patients were really happy with the services, the care that they received. But we're starting to see some patterns of they were surprised by their discharge. They didn't feel like it was planned out very well. They were getting mixed messages from different providers on their multidisciplinary team. I started to look at all those kind of channels of data sources that we discussed in the presentation here. And what I noticed is this is a much larger issue than just what information we were sending to the payer. And so, yes, we could kind of bolt on a solution and teach the UM team to use different templates and send it out. But there was really an opportunity to look at the anchor point of clinical documentation. So I worked with the clinical director as well as the product team to update the EMR and make sure that we were making clinical documentation not only valuable, high quality, but also really easy for our providers to put in things like barriers to step down, for example. And then we also worked with the medical director to work on escalation protocols. So if a patient desperately needs more care, but we're not quite seeing the criteria being met, how do we escalate that and make sure that we can get more information to justify continued treatment? Um, so it started off as just kind of a UM problem. We looked at what was causing this problem, and it was actually the anchor point of clinical documentation. So we made sure that more quality information was going in. All of a sudden, 100% approval rate for all of our requests for continued stay because we were providing good quality information. So treatment was being authorized, claims were being paid, provider satisfaction increased, as evidenced by the provider engagement surveys. They were much happier about their decision making because we trained them to think about barriers to step down, discharge planning, and capture that information. So not only were we saying, hey, we have to have this at the very end when we're talking to insurance, they learned to start to consider those things earlier on in the treatment process too. So you'll see that come out as the case study in the slide deck, but that was a fun one.
Kira, that is a wonderful example of how the principal issue originally investigated upon further inspection was the root cause of something else earlier. And good on those folks who brought Kira in to do that analysis and go through that protocol that you shared with us earlier. So thank you, thank you, thank you so much. We did have one question come in while you were walking us through that case study, which everyone, please take a look at that when it arrives to your inbox. Pretty please. A question from Kristen, and thank you, Kristen, for sending this question in. How do we schedule a time for an Opus demo? We're going to be sending some post webinar communication to your email. Feel free to respond to that or click the link within there to go ahead and grab that demo. And we'll make sure one of our wonderful solutions expert gets connected and take you through the platform. It's always an amazing full circle moment when we can have somebody like Kristen come in, I'm sorry, Kira come in and give this analysis, identify a problem, and we can use the tools, rules and permissions, templates, and systems within the EHR and ecosystem that we support to operationalize that and get rid of some of the sticky notes and post-it notes you probably have littered around your computer. Hopefully stop doing that, everybody, please, if you're doing that, and get that tribal information inside of the software and create workflows and processes to bring together all of these things we are referring to. And if you haven't seen Opus Genie, make sure to get some time on the agenda to check that out. We're coming up here on time. Kristen, hopefully that answered your question. We'll get in contact with you shortly and set that up for you. Ira, thank you so much for delivering that wonderful presentation. We'll go ahead and end the webinar here. We look forward to continuing the conversation with everyone who took the time to attend. Thank you, thank you, thank you. Any last thoughts, Kira, for the team?
No, I appreciate everyone who attended, appreciate everyone's time, and big thank you to the Opus team for hosting. Incredibly thoughtful EMR, very strategic system design that's in Opus. So I really encourage everyone to book a demo if you're even considering it.
Thank you, everybody. Have a great one.